Hi, this is Kerwin Gaines. We're here for another episode of DETV's COVID Conversations. We've had some excellent medical professionals on the air here trying to encourage those that are not vaccinated to go out and get vaccinated. For those that need the vaccination due to various reasons, everyone needs the vaccination, but also myth busting to deal with the false information that has been put out to the community via social media, word of mouth, friends and family, and really what is not happening in regards to the vaccination, and to put that, I guess, in its proper place. We don't want to call anybody stupid. We don't want to make anyone feel inadequate. We just want to ensure that you know what is accurate about vaccination. Also, where to get vaccinated and what to expect once you become vaccinated, and some of the problems that were out here. So today, without further ado, we have Dr. Leroy Hicks, and he is the head of Wilmington Hospital right here in Delaware, and the chief administrator there. Dr. Hicks, welcome to the show.
Thank you for having me.
It is awesome that you're here. I've made it known that we've had some excellent medical professionals on the show today and yesterday, and we're going to have another one on tomorrow, and just trying to get the word out. And we'd like to thank you and everything that Christiana Care has done for the community to do just that, to get the word out and make sure that folks are informed, and to squash some of this misinformation that I'm sure that you get a lot of.
Thank you. Yes, I'm looking for the opportunity to talk directly to the audience and hopefully help people understand that we're at a critical time right now. Our hospitals are full, and largely they're full because we have a large number of people who have a preventable disease, who are winding up sick, require hospitalization. And unfortunately, this is in the face of winter where we're seeing more flu and advanced disease and higher numbers of hospitalizations like we always do this time of the year. And so we need to do something in order to keep people safe. And the best thing we can do is convince people to practice safe measures, wear their masks in public, avoid large gatherings, and most importantly, get vaccinated. It's now broadly available and available to people, over the age of 5 years old. And we really need to increase our rates of vaccination so that people, one, have a lower likelihood of getting coronavirus, but two, if they should get it, become much less likely to get sick and end up in the hospital.
Heard some, I don't want to call them horror stories, but I mean, that's really what they are. They're very sad stories that we've gotten from these medical professionals here, and telling us about the tragedy that people face once they're infected, and that those folks that are really having a hard time are the folks that are not vaccinated. And they have a likelihood, correct me if I'm wrong, of just having negative results, and the treatment just not being enough to save their lives or stop from having some severe damage to their body and to their systems.
I am 52 years old, which means I've been a practicing physician now for more than 25 years. But I still consider myself young, and I have never, in those couple of decades, experienced a time where I've seen so many people who were younger than me, in their 30s and 40s, early 50s, dying from something that is potentially preventable. And it does take a toll. We routinely are seeing people who are hospitalized, require support, not only in order to breathe with oxygen, but also support to maintain their cardiovascular system. And overwhelmingly, 4 to 5 times higher risk. These patients are unvaccinated. And we're now a year into having vaccines available, and we still predominantly, without question, are seeing people who come in at their very sickest from COVID many of whom could have prevented this from avoiding circumstances where they were unmasked, avoiding large gatherings, and absolutely, had they been vaccinated, would not have gotten as sick.
Right. So the DMARC that I use is March of 13, 2020 is when this began. Everybody kind of uses their own date, but I see that as when panic really sunk in. And as of today, according to the Washington Post, there's 267,000 new cases of COVID in the United States. So Christiana Care spans, all three counties and also a little bit into Pennsylvania. But where does Delaware stand right now?
We have seen a record rise in the number of cases. We're going on, Kerwin, 4 to 5 weeks of continuously rising numbers of COVID cases. And in fact, the most recent 7-day average was 1,072 new cases. That's well over 200 more new cases in a week than we saw at the peak of last winter. We are seeing, 15% of people who are getting tested now are testing positive for coronavirus, and a year ago, we said that when that number got above 8%, we were in serious trouble. We're now over 15, we're nearly double that. We are at a critical stage. And unfortunately, there are communities that are more affected by this than others. And it really influences the life and well-being, not just of the individual patient that's in the hospital, but the family members, the loved ones, all of those people that surround the person who gets exposed to coronavirus and then has the potential to spread it. That's why vaccination is so, so important.
Yeah, and we'll get into how important it is. Interestingly enough, excuse me, Doc, we had Dr. Benenhoff, one of your colleagues, on earlier today, and he made it very clear. He said, Kerwin, I'm signing 4 to 5 death certificates regularly and sometimes daily that are COVID-related deaths. And he, it wears on you. It wears on your staff, but thinking that some of these deaths could have, in fact, been prevented through vaccination.
Yeah, yeah. Right now, we have a great amount of evidence. We know, these are facts, that if people are vaccinated, they are significantly less likely, like 4 to 5 times less likely to end up in a hospital on a ventilator and to die. And so the counter to that is that most of the people right now who are hospitalized in our ICUs or dying from COVID-19 are in fact unvaccinated. And Dr. Benioff is correct. It is a nearly daily occurrence for many, many healthcare providers.
Yeah. The President of the United States, President Joe Biden, had a meeting yesterday with the governors. And as much as I wish I could have listened in, but it was directly related to COVID and the influx that we've had due to the Omicron virus. And no one wants another March 2020. Nobody wants 2020 over again, really. But if you could have listened into that conversation, and part of that was the president assessing the needs of states, especially hot states. And I have to say, looking at the map, and again referring to what the Washington Post has presented, and the New York Times has presented as well, is that Delaware is still in an orange and red quasi-hot state. We're not doing the very best that we can. And again, to that phone call, what would you ask for? What would you tell the president right now, or what would you tell our legislators right now as far as a need that we could have, and what could we do as a community, or what could they do from a legislative standpoint to help ease this and prevent further outbreak? Or is there anything?
So there are plenty of things, frankly, and I think what's most important, if I had the ear of legislators and policymakers, I would say the following. We know that there are safe public health practices that reduce the spread of this virus. And we know that if the virus has nowhere to spread over time, The likelihood of new variants goes down. The likelihood of less controlled infections go down. Hospitals don't become full, not of coronavirus. And our population will start to see an increase in the life expectancy. Over the course of this pandemic, it's gone in the opposite direction. And so I would urge all the legislators to really think about those policies, those procedures that can be taken to ensure the public good, which include doing all that we can, pulling out all the stops to make sure people are masking. And with the advent of Omicron, that means including vaccinated people who need to wear masks in public settings. It is a key preventative strategy. I think it's also important to incentivize as much as we can people to get vaccinated, but not to do so in a way so that individuals who have chosen not to get vaccinated feel punished because of their decision making, but instead encouraged by the benefits of getting vaccinated. It is clearly important that people receive accurate information in the way that they can receive it, and in a way that they can understand about how safe these vaccines are, and about how broadly available they now are compared to a year ago. And then I think we can do all we can to incentivize the behavior to get those vaccines and keep people out of the hospital. The last thing I would want them to know is we're at a critical juncture right now. Every hospital in Delaware is seeing unprecedented volume. And in fact, I speak with leaders of hospitals from across the country frequently, spoke with a leader from the West Coast this morning. All of our hospitals are full. This is a phenomenon that is being seen in the majority of states, whether the states are, regardless of where the governor or local legislature sits on the political spectrum, this is a national issue where hospitals are full. Patients are very, very sick. Healthcare workers themselves are also getting sick. Right? It is the winter, there's flu season, and there's the spread of Omicron and the coronavirus as a coronavirus variant. We have to do all that we can to reduce the number of people who are coming into the hospitals requiring care. And in the case of COVID, which we're seeing at record numbers now, there are 2 to 3 very key strategies we've talked about that will do that. And it's time. The time is now to ensure that those things are put into place.
I love it. I love it. First of all, I agree with you more and more is that incentives are important. Sometimes people don't understand logic, but they do understand incentives. And if we can offer some type of incentive for them to mask and to get vaccinated, we're beyond looking at, well, that's not right. And, people should just use common sense. Obviously, sometimes, in some cases, common sense just is not common, as my father has said over and over and over again. But we have to ensure that we are doing everything that we can. And if that is incentive based to ensure that people become vaccinated, then that's what we need to do. And one thing that I've learned over the past couple of days in speaking with healthcare professionals is that the virus itself does not discriminate in regards to race, color, creed, financial status, or what have you. But it is important that we get the information out to all of those communities, especially those communities that have limited information. Some of those that may be technically challenged, or the information divide, and dealing with some infrastructure issues within their communities where they don't have the necessary information. How are we doing from our state in regards to educating Black and brown communities about the vaccine? And not just, so let's before we get started on that, let's just not say Black and brown communities. Let's say Black and brown communities and rural communities and communities that have income challenges.
Since the onset of this pandemic, you point to March of 2020, and I will tell you, since the onset of this pandemic, I have seen tremendous effort taking place on the part of many community-based organizations, many hospitals and health systems here in Delaware. And I'm very, very proud to say Christiana Care has taken a lead role in partnering with, everything from barbershops and beauty salons in the early part of the pandemic, to organizations throughout the state of Delaware, including talking to employees and large companies in the southern part of the state. We have done a lot of outreach. Programs like yours that are giving us the forum to come and talk directly to people, critically important. And I see and have tremendous pride in my colleagues from throughout the state doing all that they can to communicate and to partner with people in the way to make sure that we're delivering the message the right way. Yet, to your point, it still has not been enough. And I think that it's now time for us to think about alternate strategies. And depending on the communities you want to target, you mentioned infrastructure issues, lack of access, other things. People from those communities, I think, can often inform us as to the best approaches to reach them. So, my response would be that we should continue to listen to them as to the best way to deliver the message, and then be persistent, as you're doing with the show, in communicating that message. We have to get people vaccinated, particularly those who are most vulnerable for this disease and for at highest risk of spreading it. And we have to continuously reinforce that behavior of avoiding crowds, particularly not being masked in public settings, encouraging people to do those things that we know work. But unfortunately, people have become lax in doing those things, and we'll need those kind of persistent reminders.
I couldn't agree with you more, Doctor. One question that I have, and it is more of a clarification. The first part is, who is the most vulnerable? I hear that it's people with pre-existing conditions, those that are above a certain age group, those who may be obese, those who may be afflicted with other health issues. But right now, who would you say is the most vulnerable? And is it someone that's most vulnerable? Is it everyone is just as equally vulnerable to this Omicron variant as anyone else?
Yeah, so there are two ways that I'll answer your question, and they're based on at risk for what. Okay? So the first is at risk for death or severe illness, and the science has been very, very consistent on this. If you are immunocompromised, overweight, with a body mass index of greater than 30, have chronic conditions that include things like persistent asthma, hypertension, diabetes, you are at an increased risk of death should you contract coronavirus. Age, people who are older, most specifically those people who are over 80 years old, then 75 and 70, those higher age categories are at much greater risk of dying once they contract coronavirus. However, everyone who contracts coronavirus can die from the disease, which is why it's critically important for people to try to reduce the likelihood of catching it. Right? So someone is at higher risk. That does not mean if you're not 75 years old, if you don't have hypertension or diabetes, you're not at risk of dying. No, it just means that their risk is that much higher. That's the first thing. The second thing I would say is that there's a risk of spreading this. Oh, one more thing on that, by the way. We're just talking about the risk of death. Keep in mind that there are many, many people. Most people don't die from coronavirus once they have it, but many people still get debilitated. And over the last 2 years, we've seen a whole host of issues emerge where people are chronically now debilitated, including things affecting their heart and their mind and ability to think as a consequence of having the virus. So it's not all about death. And when it comes to death, while anyone can die, there are certain groups at highest risk. The second thing I was going to point to is the risk of transmission. That's the risk of getting it and spreading it. And those risk factors are really, really important for us to keep in mind. Because while anyone can be affected by this disease, there are groups that have had a much higher likelihood of contracting coronavirus, spreading coronavirus, and then based on those numbers, subsequently end up getting ill. In order for the virus to spread, it needs to be in environments where it can get to other people. So if you are in a household where no one is vaccinated, each member of that household is at a much higher risk of contracting the disease, one, and spreading it to others, because no one surrounding them is vaccinated. So the virus has plenty of places to go. That's the first thing. The second is people who live in much more crowded conditions, close conditions with overcrowding, who are also in that environment engaging in those activities that place them at higher risk, are much more likely to contract it and then spread it, not only to people within our household, but members of their congregation, people who live adjacent to them, and in the places where they normally engage socially. So again, critically important. I answered your question two different ways. Everyone's at risk.
It was needed.
Others
it was
are at highest
needed.
risk.
Right. And prior to the interview, you and I had a brief conversation, and I'm going to tell you something. The best information that I received over the past 2 days is what you told me prior to this interview, and is that one vaccination has the possibility of saving 6 lives. And I think that should be a bumper sticker or a hashtag, one save 6. And if you could speak to that a little bit and talk to those folks that are in a house, like you mentioned, that no one is vaccinated, but one person being vaccinated could possibly save 6 lives.
People have equated, their right to choose whether or not to get vaccinated to a personal issue. And what I want people to understand is that's not how the virus works. If you get coronavirus, yes, there's what the coronavirus does to your body, but there's also the fact that it spreads from you to other people. And depending on the variant, and right now we're talking about Omicron, it can spread from you to multiple people very rapidly. And what we're seeing with this newest mutation, this newest variant, is that it spreads from one person to multiple people to an extraordinarily high degree, right? There's measles that spreads very, very rapidly to people. And there's something like Omicron, which is coming up right after it.
Right.
So when one person contracts coronavirus, he or she, when they talk, has the potential of spreading it, not just the person next to them. But think about, the 10 people they meet and the fact that 6 of them may now contract the virus. And I'll do you one better than one, save one person getting vaccinated saves 6. Keep in mind that each of the 6 people that contract it can then spread it to 6 more. Right?
Right. And it just multiplies over and over and over again. And and if that doesn't scare you enough or scare someone enough, I don't know what else we're going to say. But let's go back to Christiana Care briefly. The numbers that we just talked about are staggering, and the ability for it to spread. You very eloquently illustrated it to us. But is Christiana Care ready? Are they ready to support this in case this Omicron variant does not dissipate? Although the numbers say that it's not going to be as dramatic as once thought of, according to an NPR study. But is Christiana Care ready to support folks in case this outbreak just gets out of hand?
Yeah, so I want to correct one thing, or modify one thing you said, Carwin, if I may. What we know about Omicron is that on a person basis, it looks like it becomes less severe, like you're less likely to get severely ill from Omicron than you were the Delta variant. And that is true. But it's also spread more easily. So even though an individual's risk of being hospitalized or dying may be lower with Omicron than it is the Delta variant, when so many more people are contracting it, you end up with still many more patients being hospitalized. And that's what we're
Right.
seeing.
Right.
And our healthcare system right now is equipped to continue to deliver care to patients who walk Christiana Care, who come into our emergency rooms and then get admitted to the floors. But we're being stretched thin. It is no secret that in our hospital every day, whether it's our campus in Maryland, our campus in Newark, Delaware, or here at my hospital in Wilmington, we routinely have 95% to 100% of our beds taken with patients. And when you get to that point and people continue to come to the hospital, we have to find beds and nurses in order to provide care for those patients. And when all your resources are full, that becomes an increasing challenge. We have been able to handle that throughout this pandemic to date.
Right.
But when you couple the fact that all of our caregivers are human beings too, they get sick. People contract coronavirus in the community and can't come to work. Thankfully, because they're ill, they won't come to work and place patients at risk. But when you have shortages that can occur with that kind of illness and overwhelming numbers of patients, at some point, healthcare systems cannot continue to easily place patients into beds and get them in the right places in order to provide that care. So we are equipped, but getting stretched thin. And I guess the biggest thing I would want, if someone were to take one thing out of this conversation, Kerwin, it would be the following: that we don't have to break. Christiana Care and every health system in Delaware and many throughout the country can continue to provide care for patients and to be ready to handle volumes of patients if we can contain the spread of this virus, which is something we have to start doing now. Critically important.
Right. And what I was trying to get across was that it isn't as though we have a choice in regards to which variant we're infected with. Correct me if I'm wrong, the Delta variant is still out there, and Omicron's out there, and so many other things. So it isn't as though we can say, "Oh no, I'd rather be infected with Delta than Omicron," or so on and so forth. We don't know what we're going to get. Am I wrong there, or I'm pretty
No,
sure
you're not wrong.
that
Yes, you're 100% correct. The truth of the matter is, when we think about what comes next, we continue to anticipate more Omicron spreading. But that does not mean that Delta variant has gone away. And in fact, we know that the Delta variant to date has been incredibly lethal, has caused a lot of deaths here in this country with this most recent surge, and many hospitalizations. And while it's circulating and Omicron is circulating, you don't know, and we don't know in real time what strain a person has. What we do know is that if you don't catch either, and you get vaccinated, you are much better protected, and have a much lower risk than you ever would from, well, I'll catch it, and then gaining natural immunity. People who get coronavirus, we now know, and the data are very strong and clear, can get it again and are significantly more likely to get it again and die than someone who just got vaccinated in the first place.
Yeah. I was at a dinner party, a business dinner, about a month or so ago, and I was sitting at a table with someone who I deemed as a professional. and they wax poetic for about 10 minutes about how they were priorly infected, and that they're going to be fine because they were once infected. And you try to be politically correct. You don't want to upset a whole dinner party, but I wanted to say, yeah, you have about what, a week or 6 weeks worth of, I guess, in immunosuppressant activities before you're eligible again for the COVID infection.
I would tell that person, yes, one, you're not fully protected. The odds of getting the coronavirus after you've been infected compared to someone who just got vaccinated are over twice as high. So that's the first thing, correct. The second thing that I would say to that individual is, as an incentive, as we discussed about vaccination, is that the vaccine seems to actually be more effective in people who have previously infected than those that weren't. So getting vaccinated gives you more protection against getting very ill, even against Omicron.
Right.
Having had COVID and getting vaccinated subsequently gives you even more protection than that. So an individual, I'm not telling people to get COVID. What I am saying, though, is if you've had COVID, still get the darn vaccine.
Right. Absolutely. Absolutely. And having those conversations and having the knowledge to damp down the negative information or the misinformation that's out there, I believe is imperative. And again, it shows like this that are giving people the vocabulary necessary to facilitate those conversations, whether it's with loved ones or business dinners or what have you, to be able to tell people that that's inaccurate and that's not the best way to go about this. What is Christiana Care doing to help, I guess, damp down the misinformation that's out there? Is it just talking to people? I think that's the best way, going into communities and ensuring that they have the up-to-date information.
We work without ceasing in a couple of different areas, Kerwin. The first is what we'll talk about individuals with whom we have contact. Regularly in all of our practices, in our encounters, and indeed among people who are hospitalized, including those who have had COVID-19 or are hospitalized, and patients who come to our emergency rooms. We are regularly asking about vaccination status and doing our best to inform people with every encounter that we have about the benefits of vaccination. I think that's the first thing, to your point about talking to people. We also have had extensive efforts taking place, as I mentioned before, with community-based organizations. A number of providers have worked directly to talk to members or citizens throughout Delaware, sometimes in other languages that they're more proficient in, to better educate about risk of contracting coronavirus.
That's exactly what it is.
To prevent it. Yeah. And when to get tested and all that sort of thing. And we continue to do these kind of campaigns. In fact, you mentioned Dr. Benninghoff was on your show earlier today. It's critically important, and it's part of our mission, and I'm sure the mission of others who care about human health, to regularly engage in every forum we can. So we do things on every social media platform surrounding information and trying to debunk myths and provide clear communication that we hope will benefit people. And we'll continue to do more.
So would you say, and I've asked all the medical professionals that have been on, and I think it is important, especially this time of year, to say that the rise in the numbers that we're seeing right now was contributed to people during Thanksgiving, going out and congregating and spending the time with family and friends, but not having or knowing the proper vaccination status of those that they congregated with, or taking that risk saying, oh, well, I'm going to be okay. And now 3 weeks later, we're really seeing a boom. And during that time, unfortunately, Omicron really hit the United States. So it was a perfect storm, so to speak. So would you agree that the numbers that we're seeing now is because of that?
Yes, and we've seen it after every major event where people gather in large spaces, and where people have had relaxation of standards with mask wearing. Um, we're nearly 2 years in. This is not new, and it is very clear. Uh, Thanksgiving, Christmas, and upcoming New Year's presents a risk to you and your loved ones if you are not intentional about monitoring who you're going to be around.
Right.
It is critically important, as you mentioned, if you're going to have gatherings at all, make sure that people are vaccinated, wear a mask indoors, um, or appropriately physically distance, and hopefully do all three. And consider it not only for, again, yourself and think about your individual risks, but think about the fact that even if you're mildly sick, you can make 5 to 6 other people ill just by spreading coronavirus to them.
Yeah, Dr. Fauci today has made it very clear that he expects that January is just going to be a hard month because we have Christmas and we have New Year's back to back. Folks just not taking the necessary precautions and not being honest with themselves about the results or the consequences of that. I can only imagine what keeps him up at night. But Sir, would you, I guess, expect the same thing that January is going to be a rough month here in Delaware?
Yes, and unfortunately, I think that could go into February and beyond if we cannot successfully encourage everyone within Delaware over the age of 5 to get vaccinated. And if we're not extremely careful about the environments in which we find ourselves and people not wearing masks, um, January, without question, will be a rough month. And frankly, I worry about what happens beyond January if we don't change our human behaviors right now.
The changing of human behaviors through the test of time has always been a difficult thing and has always been had an extreme amount of consequences to the human race when we've not used common sense. Back in the 20s with the Spanish flu all the way to now, it's very hard to do. And speaking to Dr. Benninghoff, I gave my example of the things that we place into our bodies on a regular basis, whether that's fast food, a can of Coca-Cola, so many things that we place into our bodies that are far more detrimental to our health than the vaccine. I want to be clear, and again, I'm not medically trained, but I am very confident in saying that the vaccine is safe. And I'm sure that if it wasn't, you would correct me. But the vaccine is very safe, and it is more than important to get that done. And to express that point, Dr. Benhoff made it very clear that he, in his tenure there and dealing with the COVID outbreak over the past close to 20 months now, he has yet to have someone in the hospital and especially in critical care, which he oversees, due to vaccine related illness. That's just not the case. And if that was the case, we would see vaccine related illnesses filling up hospitals and doctors' offices and critical care facilities. And we're just not seeing that. So that has to be misinformation.
I can state without reservation publicly my very great concern for really all Delawareans. And I would say specifically, I am Chief Medical Officer for Wilmington Hospital, the population we serve in the city of Wilmington, which is disproportionately underserved, right? A large population of Black and brown people, a large population of people who are under the federal poverty line. And many of these communities we see have had their life expectancy even more affected, shortened to a greater degree because of this coronavirus pandemic. And what is really striking is these very communities, and again, this is pervasive, are subject to so much misinformation about the vaccine.
Right.
Dr. Benninghoff hit it on the head. We do not see people being hospitalized or falling severely ill from getting a vaccine. But I would add to your very clear and I think well articulated statement that vaccines are safe the following fact. They're the most studied vaccinations in human history,
The most studied.
without, without question.
Yeah.
They have had the largest number of people from all kinds of backgrounds, multiple countries, multiple racial and ethnic background, the largest percentage of Black and members of the African diaspora who have participated in trials about vaccines, participated in the trials for these mRNA vaccines. More Latinos than traditionally participate in clinical trials have been in these vaccines. We've more than a year of experience of millions of people throughout the globe getting vaccines. And we're not seeing people die from the vaccines nor being hospitalized from it.
And
But we are seeing these people die routinely from coronavirus.
the availability of the vaccine, and I want to make it clear, and the best way that I've learned so far is to share my own testimony, is that I went to my local Walgreens, which was about 2 miles away from my home, made a very quick appointment via my phone, and was able to obtain the vaccine. I had nothing more than a sore arm. I felt a little bit of cold-like symptoms for about an evening. All that could be treated with Tylenol or ibuprofen, and honestly could have worked through it. And for the booster, it was similar. I got it at my local Super G. I had a cart full of pork chops and everything else, and I stopped and I got my booster and I kept it moving. So it's out there. It is without cost. It is well studied, and it's urgent for all of us to get it. But the availability is there, and I know Christiana Care also has availability to that as well, and makes it readily available for all Delawareans that are interested in obtaining the vaccine.
That's right. And early in the pandemic, when it was a much smaller supply, very, very early on, we really were concerned about access to vaccination. To your point, we're no longer concerned. It's available through, retail pharmacies. It's available through many healthcare organizations here in the state. In fact, I would encourage anyone who has an interest in finding a site for getting vaccination to go to de.gov/coronavirus. Our local government has worked tremendously hard to compile resources in a way people can understand about vaccinations. And so I think in addition to seeking your, access at your local pharmacy, again, de.gov/coronavirus is a good place to go. And ask your providers. This is the time where we're approaching a critical juncture, where we're, at a point where we're in a state of emergency, where people continue to die of something that's preventable, one, and two, are continuously getting hospitalized at increasing numbers in a system that can't just continue to grow, right?
Right.
Hospital beds across the street are fixed in number. They've expanded miraculously because we've done all we can to provide, good care for people. But at some point, the balloon reaches maximal stretch. This is a time we have to decompress it. And the best way is vaccination and wearing masks. Can I just say something about additional safety factors, Kerwin, and I think people have to
Dr. Hicks, you
consider?
can say whatever you'd like. The floor is yours, my friend.
I grew up in the church. My father was a minister, and so I spent virtually my whole life in large congregations. I understand the joy one gets from being around family and friends, large dinners, large gatherings for Thanksgiving. Everyone was welcome to the Hicks household. I get it. What I also understand is we approach New Year's. and coming off of Christmas and Thanksgiving is the following. Being unmasked with someone sitting right next to you. Eating in restaurants where you're surrounded by people who are not masked because they're eating, drinking, talking out loud. And knowing that fewer than 2/3 of people, of Delawareans who are eligible for the full series of vaccinations, less than 2/3 have received it, places you at risk. All of these people aren't vaccinated. There's no way statistically for that to be possible. The risk is enormously high. So yes, I'm encouraging everyone who is eligible to get the vaccine to get it. It is safe. It's the best study we have. There's new literature every day pointing to the safety profile of vaccines and debunking myths. But I am also encouraging people to be wise and understand that congregating in large groups without wearing masks is detrimental to your health right now and detrimental to the health of those people who surround you.
One quick question, Doc. You're telling me these staggering numbers, 2/3 just haven't been vaccinated. You know the facts. You get the facts every day. And I want to be very frank, if I could. How are you holding up with all this? How are you as a healthcare professional dealing with this from a mental health perspective, or just downright morale, where you have to come and deal with this every day? You being the hero that you are, your staff being the heroes that they are, from the nurses to the paraprofessionals, all the way down to the clerical folks that are there ensuring the documentation and everything is in order. How are you holding up?
My spirit is buoyed, is helped um, by the realization that my colleagues, and not just the doctors, I'm talking about the nurses, I'm talking about everyone from the people who make sure that the beds are clean and rooms are sterilized, to the people who push patients around in our hospitals, to the doctors and nurses and other professionals, are coming to work every day because their intention is to actually benefit the health and well-being of the people we serve. And I am honored and impressed every day by that dedication. I see it, it surrounds me, and it strengthens me. At the same time, Kerwin, I continue to grow concerned about the life and well-being of the people we serve. And it is particularly disheartening when I very clearly have answers. It's not frequently in medicine that you have very clear answers for things, right? There's so much that's still unknown. But in this case, there are things that we know will benefit us and reduce our risk from dying. And when we see that people are unfortunately receiving information that is false, are not taking the appropriate actions to keep themselves safe, it hurts. It hurts to talk to the caregiver who has lost 3 patients in a week, sign their death certificates, as Dr. Benninghoff mentioned, knowing that the likelihood is that none of them had to die if they had been vaccinated, if they hadn't been, drinking and singing loudly in a bar around other people who were unmasked and unvaccinated. If the behaviors had been differently, their lives could be safe. It's disheartening to watch someone take their last breath and then wonder if they're taking their last breath because their spouse was the one person who opted not to get vaccinated and went to a restaurant the week before, right? And then came home and spread coronavirus. It is disheartening to see people who day in and day out toil to provide care for everything from young adults to the aged who have coronavirus, walk out of the hospital, and then come back in to face it all over again same picture every day with a large mass of people who they know didn't have to be hospitalized. Their persistence in delivering care that is aimed at improving lives is a wonderful thing to observe, and it is a source of strength. And simultaneously, it's a source of concern because I care about our caregivers and I care about our patients alike.
So I encourage you, sir, for the sake of all the population in which you serve and for your hospital, hang in there and we will get through this. I would like to dismiss another misnomer, and that is some people don't go to the hospital when it's necessary because they feel that the hospital is unsafe. Well, that's where everybody goes that's sick. Please encourage folks, if you could, to go to the hospital, to contact their medical professional. It is still a safe place to go.
The wonderful thing that was done by many healthcare organizations across the country several months ago was to say that our number one priority is making sure we have a safe environment. And as a result, every single person who works in Christiana Care, as I mentioned, whether it's someone who's cleaning our rooms or me as a physician myself, all of us are vaccinated in order to be employed here. We created here in our organization an environment where you are at your safest, where we require everyone to wear masks when they walk in the hospital. And again, as a condition of employment, our caregivers, our employees, required to be vaccinated, right, in order to work here. Our goal is to create that very bubble of safety to reduce the spread of coronavirus we want people to ensure in other settings, right? Exposure to people who are safely providing barrier protection by wearing masks, even in the hallways, cafeterias, and places along the way, and receiving care from healthcare workers who themselves don't come to work when they're sick, are vaccinated, and wearing appropriate protection. Christiana Care, Wilmington Hospital, Christiana Hospital are among the safest places to be from a COVID perspective right now. What we don't want is for people to come to the hospital unnecessarily.
Okay.
If you feel that you are ill, it is essential that you contact your healthcare professional, right? Your physician assistant, your nurse practitioner, your physician. Reach out to them as soon as possible. Engage in care. Make sure that you are seen. And follow the recommendations of your doctors and your care team. But feel safe in knowing that if you're here in the hospital, it's because you have to be here. And we've done everything we can to assure a very, very low likelihood of you catching COVID in our hospitals.
Are elected procedures at risk currently of being stopped, or was that just early on?
No, we no, it was not just early on. When you asked about being prepared for what may be coming throughout January, it's important that we realize that we have to have environments where patients can get to their right unit with the right staff of nurses and doctors to provide that care. And when you have 300 hospital beds and you have 285 patients who have to be in the hospital or they may not survive or do well, you reduce the number of patients who are in the hospital but don't have to be in the hospital because they're at imminent risk of dying or becoming very ill in a short time frame. Does that make sense? So
It does. It does.
We will always assess which surgeries really need to be done, because there are many, many surgeries that not only need to be done because the patient's at risk of dying, but also because their disease may progress without the surgery. And we always seek to do those procedures, right? We do not want anyone to get sicker. We do not want
Right.
to stop providing health care because of COVID. But what we are going to do is continue to watch out for those procedures that don't require someone to have a surgery right now to help prolong their life or prevent disease from getting worse, if we're going to need hospital beds, because the number of admissions remains so high.
Well, Doc, in our final minute here, I want to give you an opportunity to have that lab coat discussion with the members of the population here, and to encourage them. Your last plea that we can get out and during this broadcast for folks to get vaccinated. What would you tell them, sir?
There are people who love you. Um, and I think it's really important that you protect yourself, but you also protect the people who love you. Whether it's from their sense of loss because you became ill, became very sick, got disabled longitudinally, or died, or whether it's protecting them themselves from getting sick. The best way to do that is to be safe. For New Year's, this is not the time to engage in public settings, hugging and kissing people, not wearing masks. You don't know who has coronavirus and who does, right? Practice safety. Avoid large gatherings. Wear your mask consistently. And most importantly, as soon as you can get a vaccine, if you're unvaccinated, get the vaccine. If you've been vaccinated and you got your first two shots of the mRNA vaccines, or one shot of Johnson & Johnson, and it's time to get a booster, that would be 6 months after the two-shot series, 2 months after the Johnson & Johnson vaccine, get your booster. Do it for yourselves, and do it for your loved ones. And to your point, Kerwin, if we can encourage one person to do that, we may save 6 other lives. It's really, really important.
Well, again, it will be my mantra until this is over, or until you correct me, is that one can save 6, and to go and get it done. I want to thank you, Dr. Hicks. This has been an excellent conversation, and I hope that people have heard it. We have given them the ability to replay it over and over and over again. But thank you, and thank you for the staff. Please stay encouraged as a staff and continue to help and serve the community in the way in which you have, and ensuring safety and health for everyone. Thank you very much, Dr. Hicks. Thank you very much for this conversation. We hope that it has educated our listeners, and that they will continue to do the right thing and get vaccinated. If they can't do it for themselves, to do it for a loved one. If you can't do it for a loved one, do it for someone you don't know, because you could, in fact, save their lives. This has been DETV's COVID Conversations. And yet again, I want to thank you for taking the time to watch. And we look forward to talking to you again about this and several other topics very soon.
This message is brought to you by Newcastle County Government.
The speed at which the vaccine has come about has given a few folks pause. But when you're losing 500,000 lives in a span of 6 to 8 months, you must respond quickly. The good news is the technology, the messenger RNA vaccination, is 30 years old. It's been in the lab waiting for the opportunity to take place. Now, most vaccines have taken years to perfect, but you weren't in the kind of crisis that we're in right now. I mean, this is the largest pandemic in 100 years. So you've got to respond quickly, because it's responding quickly. And that's the misperception. It's old technology applied in a very new way for something that was deadly and continues to be.
This message is brought to you by Newcastle County Government.
Hi, I'm Dr. Neil Hochstein at ENT and Allergy of Delaware. We've been very fortunate to be protected from COVID-19 with the vaccines, but now we're hearing a lot about booster shots. If you're over 65 or have some immune compromise, booster shots are an effective way to strengthen your immune system again. It's the same vaccine that you received with your first or second dose, and it can extend and strengthen the protection that you've already received. Keep yourself and your friends and family safe. Thank you.